Hey, good to see you. How are you today? Good, great. Well, as you know, I'm Dr. Elo. I'm going to be working with you today to talk about your upcoming potential surgery. Yeah, okay, great. So you are here, you're interested both in a rhinoplasty and a septoplasty, is that correct? You want to fix your... Okay. Okay, just get this. Sorry, I just got a little chilly, so I put this on. Okay. Alright, so you're saying here that you... Plasty and septo. Okay. And can you tell me a little bit about why you want to have this done? What's been going on? Okay. Okay. And you were 6 when that happened? Did you have any difficulty breathing before that? Yeah, I know it can be hard to remember. Okay. So you had the accident when you were younger, and then it's only been more recent, but you've been suffering with your breathing? Okay. Okay. All right. So your main goal, what would you say is for this? Just get that breathing better. Okay. Okay. And then you're also wanting to change the shape a bit. That's rather common, yeah. I understand. People often pair these two surgeries together. It's kind of like, you know, if you have a hernia in your stomach and you ask to get a little bit of liposuction while they're down there, kind of thing, you know, it's a similar kind of situation. Some people just come to me because they want a different nose shape. Some people are suffering from birth defects, poor breathing like you. There are a host of different reasons why people could want these surgeries, but it is very common to combine the deviated septum surgery and a little bit of a rhinoplasty. Now, I will say that the deviated septum surgery can slightly alter the appearance of your nose on its own, because when you get in there, so essentially the nose here has some bone, which is, you can feel, yep, right there. The hard part, that's usually on your bridge of your nose, you know, and it extends backward. So you have a breakable, you know, bone part here. And then when you get down more into the tip of your nose, where your nostrils are located, this, from about the middle part, you can kind of feel. Yeah, right there. That it starts to get a little soft. Yeah. So this softness is cartilage, which you may already know. There's the upper lateral and lower lateral cartilage, which is all behind the skin that you actually see as your nose. Okay, so since it's such a complicated infrastructure, you know, every move that's made, even if it's really small, can have a drastic difference. So sometimes, even if people are happy with the shape of their nose, they will include a rhinoplasty with their deviated septum surgery just to make sure that they're getting a similar shape to what they already had. But in your case of wanting to slightly change that, it doesn't necessarily make the surgery more complicated. What I'm going to do here in a second is just take a really good exam at you and see everything about your face, your nose. We're going to talk about your medical history, anything that I would need to know, okay? And we'll make sure that we really feel like we're on the same page about what you want. Yeah, so take your time. I have all the time in the world. Feel free to ask as many questions as you want to as we go along. Do you have any questions for me right now? No? Okay, great. Well, get comfortable. We're going to be here for a little while. Let's see. So we do need your medical history to a point, because I need to make sure before we go ahead and do a surgery that this is going to fix the problem. I don't want to put you through all this and then you still have breathing issues. So sometimes people have weight, like dietary, physical, or other sort of sleeping positions, pillows, things, apparatus that is not right for them or is not working well with their bodies, and that can actually cause a lot of sleep issues, breathing problems, etc. Okay, so starting with that, do you have that feeling of being congested? And did you say that was on your left or on your right side? You're right, okay. Do you have that issue of feeling clogged up and like you can't breathe only at night, or when do you notice that? Okay. Okay. Well, that's a good sign towards surgery then. A lot of times when people just tell me that they're having difficulties breathing at night, that can often go a different way. Okay, so, and I think you're doing the right thing if you've gotten to the point where this is impacting you every day and you feel like you can't breathe out of your nose. That's very uncomfortable. Yeah, some of us have to deal with that just when we have, hay fever or something, and it is so miserable. So I definitely understand why you want to get that fixed. Have you been relatively feeling healthy lately? Any issues? Right. Okay. Okay. So just your normal kind of seasonal colds and stuff like that, nothing major. Okay, good. Do you take any medications currently? Blood thinners? Okay. And does anyone in your family have the same issue? Has anyone else been through the surgery before your mom? Do you know how that went? Okay. Okay. All right, good. Well, I think that's all the preliminary stuff I really need right now. It's not a lot based on your answers, so that's good. Are you ready to go ahead and get started with the examination? Okay, great. All right, so the first thing I'm going to do is just look around. I'm going to get some hand sanitizer here. Okay, and you can just relax for me, okay? I'm going to come really close and just kind of inspect your whole situation here. I might have you turn a little bit for me from time to time, but for right now you can just purpose of this is to get a really good acquaintance with your face and nose, and just to see, some of the kind of things I might do can have impacts, like I said, on the rest of your face, because it's all connected. So I really need to get an idea here of how your cheeks, connect here with your nose, and when you move, and I've been watching as you've been talking to see what all, moves. Some people, the tip of their nose really moves a lot when they speak because of the tautness between that area and their lip. So for some people that's something to consider, and for others the lip is a little less tense, so the tip of the nose doesn't move as much. Yeah, I know, I always get distracted when I see that, and sometimes it's really cute though. I do see a slight, I feel the sort of ridging that you're talking about, which probably is from that childhood accident. And does that hurt? Okay. Does that hurt? Okay. And how about that? No? Okay, good. So there is definitely some sort of little granules feeling near your bone part of your nose, which indicates that you may have had some small pieces of bone sort of fragment. Not enough to call it a broken nose, but enough to where some of, almost like a splinter of bone may have shifted, broken off enough to where over time that has just sort of shifted within your nose cavity, now your nasal cavity, and it's creating that feeling. Who knows? I'm gonna look in a moment again with a flashlight in your nose and see what I can see. There may be some visible swelling in there that is causing that sensation of a clogged nose. Okay. In terms of, let me just make a note of that real quick, sorry. In terms of shape, so tell me first, what is it that you're trying to change? Because I think you have a cute nose, but it's your life, your money, your face, and I definitely want you to be happy. So I don't mind a little bit of bumps or hooks or crookedness or whatever, because I think that character can be kind of cute and endearing. But what does it feel like to you? Yeah, and try to be as honest as you can, because I'm on your side and I want to make you the perfect nose that you want. I want you to be really happy when this is over and done with. So just be honest. You can say whatever you really feel. Okay. So you like more of the kind of almost an upturned nose, but not quite. You like it to be sort of flat. Okay. I do think that is a possibility for you, because even though you have fairly thin cartilage kind of in this in between, like inside cartilage looks kind of thin from what I can see right now, the sort of bulk of your nose, the bulb part at the bottom, which not everyone has. You and I have. This part is just all shapeable, all changeable. So since that skin is thicker and you have enough of it, I think that it should be easy to get that kind of like, yeah, exactly, that cut nose shape. That's, you don't want like a huge swoop, right, with like a flicked tip at the end. Okay, so you just want something that's a little gradual. Okay, yeah, that kind of makes me think of like, in terms of famous noses, that that kind of reminds me of like Emma Stone or Kim Kardashian, or I'm trying to think of all kinds of people who have a similar kind of nose shape, but just from what you're describing, it sounds a little more petite, which I think they'll fit your face very nicely. Your Facely sounds like an app. Okay. And some people also choose at the same time to do something with their chin or their cheeks. I think that your chin and cheeks are proportionate, so I don't recommend adding any unnecessary surgery that you don't need. I think that you'll look great just with the rhinoplasty, and most importantly, you will be able to breathe well once we fix that deviated septum. So some people, though, I'll offer, if they want to add a chin implant or cheekbone implants to balance, because some people their nose is just a little too large for the rest of their face, and if they have a small features, petite features, adding a little bit extra dimension in the chin and cheeks can really balance out that nose and make it look smaller at the same time. But I don't think this is that drastic. Like I said, I like your natural nose shape, and I think if you didn't have to have the septoplasty, I wouldn't even encourage you really to get the rhinoplasty unless you really, really wanted it, because they don't always go how you plan, as you've probably seen in Hollywood. But I do feel I'm really confident based on what I'm seeing so far. So I'm also going to use my flashlight now to look around. Is that okay with you? Okay. So if I can just get you to tilt your head back. I don't want you to feel strain in your neck, but just far enough back that I can shine the flashlight up at your nostrils and take a look. Okay. And if you need to close your eyes, that's fine. Okay. Here we go. So I'm just gonna take a peek. You've got, your left side actually looks pretty good. It's a little tight, a little thin towards the top. I think that might be just from the right side. So let's take a look in there. Okay. Yeah, so on the right you have definite blockage, which you knew. But I do see it does look kind of like I suspected, that there's a bit of bulging on that area, which is consequently impacting your left nostril as well. And I do think that if you let this continue for too long, there is a chance that it could close up your left side breathing as well. So I definitely think this is you're in excellent excellent candidate for the surgery. Okay, that really confirms it for me. Okay. Next thing I'm going to do, if it's okay with you, let me pull up the program here. I've got just a little Polaroid camera here. Do you mind if I take a couple of your photos? They're gonna be for like before and after. For one, for your own purposes. We don't display them online or anything. And then also we can upload these into the computer, and you can take them home with you. They'll be on our online sort of portal, and you can access them, and we actually have software that you can use to play around and see what you would look like with your nose shape and if it's really what you want, etc. Yeah, so I'll take these pictures, we'll upload them to the computer. I'm gonna while those are sort of getting online, because our internet isn't that fast here, I'm gonna continue to look in person and talk about your current structure versus what we're going for, etc. Just continue that exam. We'll talk a little bit more, and then I can show you that, so we can make sure that you have access to the software. And then when you go home, you can play around with it. You'll come back in and see me in like 3 days, and we'll talk about it from there. We'll see what you like, what you don't like, and then I can kind of take over with the software and just make sure that it's perfect, and we'll go over it together at that point. Good. Okay, great. So I'm just gonna turn the power on here. Okay. If I can just get you to look here. I know it's confusing. Okay, and you can just stand up straight for me, straight ahead. Ready? 1, 2, 3. Okay. Gonna let that, and then can you turn your head to the side for me? We're gonna get your profile. So I need you to be nice and to the side. Okay. Ready? Good. Okay. It's cool, right? It's so funny to me to see those now, because growing up, my grandparents had like an old big Polaroid camera, and I just always thought it was so cool. And now they have these little handheld ones, so you can just get it like a local electronics store. Yeah, they work pretty well, actually. They're very the photos are cute. They're what you expect from a Polaroid. They have a slightly vintage kind of look to them. The coloring's not perfect, but these ones are actually really clear images, which is what we need for the software. So that's why we do the particular camera that they have here. Anyway, sorry to go on a tangent. So I'm going to have those start uploading to the computer. Okay. And while we're doing that, let's just look again here. So I see that so your bridge kind of is fairly straight. It does bow out slightly on your right side here. Not too bad though. So when it comes to the sort of landing of the nostrils here, do you know what kind of shape you'd like for that? So like some people have a very curved nose at the bottom there, and it's rounded, and there's some extra skin. I don't have a whole lot of extra skin at that part of my nose. Most of mine is more towards the tip. Some people might have a very thin tip of their nose. You might be able to think of some friends, celebrities, whomever that you know that has a very kind of tiny nose tip. Well, sometimes those people still have larger deposits of skin towards the back, so their nose has a more open appearance. You can usually see straight into their nostrils, but it sounds to me like you'd rather have sort of lower lying nostrils that you can't really look into. I think it really just depends on the shape and the person. Like, I sometimes think that having a big nose, an open nose, can be really striking, can be very beautiful, and have a lot of character, personality. I don't think that a big nose or a different nose means a bad nose. Everyone's is different, of course, but there are certain shapes. So some people have a very straight, very, very straight nose. Other people, they couldn't just lay their finger right on top of their nose because it curves too much. For that, they'd be pushing their nose tip down. Other people have a very crooked nose. You think of like Owen Wilson or someone who's got a bumpy nose. And you have some people that have like a hooked, what's called a hawk nose. So you see this a lot in cartoons, like with villains. They have a big hooked nose. There's a Greek nose, which is straighter and more like what you'd imagine on a Grecian statue. Not necessarily petite, but straight. Think like Ryan Gosling, or for the hawk nose, someone like Adrian Brody. Yeah, exactly. And then in terms of the smaller sort of noses, I guess, there are petite sizes that turn up, like we talked about, and ones that level off, and ones that have a little more of skin, cartilage, whatever you want to call it, at the tip, like mine. I mean, I would say right now your nose is in a medium range. I think my nose is also in kind of a medium range, not necessarily petite, not necessarily large, just kind of proportional. Right. Okay. All right. So those are still uploading. They're like 30%. Okay. So yeah, like I was saying, when I get in here and really look at your cartilage, I really do feel like there's plenty to work with to make this shape. And I also think that as long as there's nothing else in the deviated septum, because you are kind of guessing about that accident, right? Okay, yeah. So we could get in there and realize that there's another problem entirely, but based on your story, we're gonna imagine that that is the case. Okay, so that being the situation, we will go in there, we'll kind of deconstruct what we have to, reconstruct what we need to, and then we'll work on the outside. We'll do the inside first. Exactly. And let's see, just gonna get a couple measurements now. Got a little tape measure here. Okay, let's just see. Sorry, yeah, you can just hold still. And can you smile for me? I'm gonna have you hold it for quite a bit. Okay, just smile. Okay. Good. Sorry, I know it's uncomfortable. Okay, relax. Okay. And can I get you to frown for me? Just sad face. Okay. Okay. There we go. Okay. Thank you. Sorry, you can relax now. Alright, and now I'm just gonna look at you from the side and I'm gonna have you do some facial expressions for me, okay? So I'm gonna start on your right side, your problem side, okay? And if you can just look straight ahead for me and please smile. Good. Look up a little, like tilt your chin up a little. Keep that smile. Okay, good. You can look just down the center again. Great. Okay, and can you make a sad face for me? Good. Raise your eyebrows for me. And puff your cheeks. Good. And look here and say lemon, 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 lemon. Okay. And we're gonna do the same thing on the other side, okay? So just look in the back for me like usual. You can pick a spot. Okay. Can you smile for me, please? Good. And frown. Look up. Excellent. You can bring your head back to neutral. Okay, and smile for me, please. Okay, puff out those cheeks. Good, and look here and say lemon, 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 lemon. Okay, good job. I know that seems ridiculous. It's just some little test for me to see how your face moves. Okay, can you open nice and big for me like you're really, really surprised? Just everything. Good, and just, you don't have to make any noise, but just kind of like stay flexed open like that for a second. Good. Okay. And then, sorry, relax. Can you scrunch everything up really tight for me too now? Close your eyes, mouth, just make it all really small. Just like that. Good. Good. Well, it looks like those photos uploaded just fine. They look good in the computer. I think we got good shots. And the software accepted them fine. So, do you want to set up your portal real quick? Okay, great. I can just do it for you. So I'll send you an email. What's your email address that you want to use for this? Numbers? Okay. Alright, and usually we just do the login as the person's name. Do you want to do something else? Okay. Okay, and then your password. Do you want to just do like your birthday year, or do you want to make something up? Okay, I'll do it as your birthday year for now. And then if you want to change it when you get home, there's an option, okay? So don't forget, it's just your user ID and then your birthday for your password. Okay, yeah, I couldn't think of the word for some reason. Okay, so we're in, you see? Yeah, it's pretty cool, right? And then you can just kind of, I just have a trackpad, not a mouse, but yeah, you see, so you can kind of like scroll here through and move. Yeah, it looks weird when you're only doing one nostril, but you can balance both nostrils, and it gives you these little, you see these little guiding lines here. Yeah, so you can like double click and get a grid over your face in the front and in the profile, and it will make everything kind of perfect for you. It also is like really nice software. So if you change something from the front view, you can have it selected to also change the side view simultaneously, because obviously we don't want people to create a profile that doesn't match the shape that they want from the front. So if you want, you can link the pictures together and it will kind of like move one while it moves the other. You don't have to do it that way, but I do recommend that, because like I said, then you won't come to me and say, oh, I really like, this profile for crooked nose, but I really like this, turned up or button nose for the front. If they're not compatible, I obviously can't do that, right? And a lot of people only take into consideration how they do look from the front. When I have cases who have really, really large noses or really strong profiles, they're usually like 3% maybe of my total patients, and they're the only ones who really think much about the profile. Yeah, most people either are here because they're trying to, breathe better, or they want to look different from the front, right? How they see themselves, exactly. Okay, so we've got you all set up with that, and you're welcome to play around with that. I'm going to import all of the measurements that I took from you into the software as well after you leave, so that you won't be able to do anything larger than that, right? Because we really, there are like skin grafts and things, but adding to a nose is not really that common. It's usually subtracting. Adding is horrific injury, different kind of surgery, that kind of like different recovery process and all that, which we should talk about. Okay, so do you know much about this surgery? That's okay. So essentially, what's gonna happen is in a few days I'm gonna see you again. We're gonna go over and finalize our intended shape and our hopeful outcome. In terms of the surgery, it should only take maybe, I would say with you, 60 to 75 minutes, depending on how bad it is when we really get in there, but it shouldn't be longer than a couple of hours. It shouldn't even take 2 hours. It should be under 2 hours easily. Okay, so we'll get you, I think we're gonna do a general anesthetic. Is that okay with you? So you'll go to sleep. I think that's the best option. We'll get you in there. We'll get everything straightened out. We're going to put some soft splints in your nostrils that will hold everything kind of together. I ask that you don't blow your nose, don't do any excessive exercising, anything that can kind of hurt the healing process. We're going to try to stay away from spicy foods, crying, blowing the nose. If you can elevate your head more often than not, that's great. Like if you could sleep in a more upright position, not totally even, but just kind of with an extra couple pillows or something, that would be helpful. Recovery time usually takes, good question, like 1 to 2 months, but we'll still kind of see each other for a follow-up for about 3 or 4 months, depending on how it goes. Okay, and we'll just make sure that you're healing fine, no issues. Good question. Yeah, so there may be some minimal bruising, like along the bridge here, maybe around your eyes, some, but it shouldn't really be that bad. It's often exaggerated for the movies. Yeah. And I'm also going to have you not take any over-the-counter pain medication like Tylenol, Advil, Motrin, any of that stuff from now until the surgery, and then also after the surgery for a couple of weeks. Right. Because a lot of these patients, and a lot of times with nose surgeries, there can be fluid loss, let's say, and a lot of people already experience nosebleeds and things, so that's why I was asking earlier, are you on any blood thinners, do you take any medications, because we don't want to increase the risk of that bleeding being out of control during the procedure. I like to keep everything I run a very tight ship. As long as you do your part, I'll do mine, and we'll definitely get you the best result that we possibly can. Again, like I said, our main goal is going to be opening up that breathing passageway so you can be comfortable. Okay. Yeah, likely this will be the only time you'll ever have to do this. If you were to sustain another injury, potentially you might have to have a surgery again, but this should be a permanent surgery. Yeah, thankfully. And do you stay with anyone? Like, do you live alone? Okay, so I don't know what the schedules are like for you and the people in your life, but if anyone can be around to help you, at least for the first couple of days after the surgery, not that you're going to need constant monitoring or anything, but you may be a little sluggish and not as, what's the word? Like your reflexes and sort of capacity to think on a dime will probably be lowered from their natural state. Okay, so we don't really want you to drive. And it is an outpatient procedure, so you can go home the same day. So if you can have someone who can bring you home, that would be great. If you can have someone who can be there when you need to change clothes, that would be even better, unless you have button down clothing or things that you can step into to wear. We're just trying to minimize the amount that your arms have to go above your head, and exactly. So just to like save from any chance of rupturing, hurting, slowing down the healing process. It's not necessary, but if you really want to give yourself the quickest recovery, you can baby yourself, and people can help you with things like that, or you can just know ahead of time, like, okay, I'm only gonna wear, these things, etc. Okay. You're certainly allowed to dress yourself. Okay. You shouldn't really have any issues with like eating. Some people feel a little I wouldn't say nauseous, but just a little off in their stomach after the anesthesia. It's very possible that you'll feel fine at first, and then a number of hours later, if you haven't eaten, your stomach might get a little funky feeling, and you also just might get tired and a little out of it and just kind of want to sleep, which I recommend anyway. Okay. So that is all I can really think of. Do you have any other questions, or did you want to go over anything? Mm-hmm. 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 Okay. I wouldn't be terribly concerned about that. I think that we'll remove anything that is in there that isn't in the right place. So if there is excess bone fragment that's floating around in there, we should be able to get all of it. And I'll make sure, since you did have that injury, that I'm very, very meticulous when I'm working through that area, because it is inflamed, like I said. So that swelling is going to impact my visibility, but I'll make sure that I really pick through there. It doesn't quite look, there's definitely scar tissue. That's really what's kind of building up in there, is a scar tissue. Okay, so it's going to be a little hard, a little thick, a little difficult to work with, but most of it we're just going to get rid of, because you do have enough cartilage and bone still in there, since it was so little that was splintered in the first place, to shave that down and just kind of get rid of the scar tissue area altogether. Yes. Mm-hmm. Okay. All right, great. Okay. Yeah, you can schedule your next appointment just kind of on your way out if you want, or you can give us a call. Okay. Great. Well, I'm really looking forward to this. I think it's a huge deal. It's a big change, but this is clearly something that you want, and something that I know for sure is going to improve your quality of life, your ability to breathe, be active, sleep better. Yeah, it's going to be amazing for you when it's done. So I'm really looking forward to helping you with that, and the fact that we can, fix up some other stuff that you just want a little bit of tweak done to in the meantime. I say that's fine. Why not? And I think, you look great. You're going to look amazing, and I hope that you're excited. Yeah, I definitely am. I'm gonna make sure that I do my very, very best for you. And I appreciate you, being so patient, and please go online, and I know you probably want to, but just sometime within the next few days before your follow-up, just see. If you end up not having the time, we'll play with the nose shape just when you get here. But I do think that people end up having the best kind of result when they have plenty of time to just explore all the possibilities and really see, like, oh, okay, if I, slightly move this, it's gonna move that. It's all the, yeah. It's hard to really know. I think a lot of people aren't aware of the fact that the nose is a very difficult thing to work with because of the way that it's built. The margin for error is very, very small, and it's all very interconnected. It's like the focal point, of any given person's face. So it interacts with the rest of your skin and your features, and really interprets how you look to other people. So I know it's a big deal, and I definitely wouldn't be approving this if I didn't think that we were going to be able to do a great job. Okay. All right, so do you have any final questions for me before we leave? No? Okay. Well, as you know, here at Quake Clinic, you're more than welcome to lay down, take a little nap if you want, or just kind of hang out until you feel ready to embark back into the world. There are snacks, beds, a hand washing station. Whatever you need is here for you. And like I said, if you're up for it, you can book your next appointment on your way out. If not, just give us a call, okay? All right, excellent. Thank you so much. It was great to see